Hey everyone, Dr. Gage here, bringing you a video today on a condition that we've recently covered in our Instagram Reels series, as well as our Teach It Tuesday series. But this is a condition that we see common as chiropractors. A lot of our desk workers experience this, people who are typing long days, even some of our golfers, tennis players, where you're using a lot of the forearm muscles here. And this condition we're going to cover today is carpal tunnel syndrome. Now, in our Instagram series, we talked about, is it carpal tunnel syndrome versus median nerve entrapment, okay? These are two very similar conditions. However, with median nerve entrapment, we talked about how that median nerve, as it passes through the pronator teres, can become impinged, and this can replicate carpal tunnel syndrome. With carpal tunnel syndrome, there's actually true structural changes causing the compression of the distal portion of that median nerve, but it's down at the wrist here. This can be bilaterally, so in both wrists or just in one wrist. We'll typically see it bilaterally if it's related to an arthritic condition. But what it is it's that narrowing of the joint space. So in your wrist here, you essentially have a tunnel, and all your forearm flexors and hand muscles and the nerves in here will pass through that tunnel. There's only so much space in there, right? And if that tunnel is for some reason compressed and shrunk down, it can put pressure on the median nerve there, and that's where you'll likely experience the common symptoms of carpal tunnel syndrome. These can be paresthesia or numbness, tingling along the middle of the hand or even into the index side of the hand here. Typically, these first three fingers will experience it the most. Some patients experience motor weakness with that, so you might have trouble gripping things with these three fingers or extending them. But a lot of times it's that numbness or tingling that's occurring there. Carpal tunnel syndrome, like we said, is typically that compression of the median nerve there. And however, we do have a wide variety of treatments we like to utilize for releasing some of the muscles surrounding that area. And this involves muscles that aren't only involved in down here at the wrist, but also more up into the proximal forearm near the elbow. And so with that comes things like shockwave therapy that can be proven to be very effective at releasing muscle tension, decreasing that pain and inflammation in the wrist, helping improve blood flow to the area. All of those can be beneficial, and of course our stem cell recruitment to repair any tissue damage in the area there. And then we like to utilize a lot of active release techniques, so manual muscle therapy on different forearm muscles on both sides of the wrist here, as well as Graston or muscle scraping. We'll utilize that as well to help just free up as much tension in the forearms and even into the hand and the wrist here as possible. Another thing that we like to utilize is rehab. With rehab, we can do various exercises to work on the wrist mobilization as well as the forearm muscles here. And this can be a condition that can be a little bit tricky to treat. Once we have narrowed it down to a true carpal tunnel syndrome, then we're able to come up with a well-rounded treatment plan to help you get out of pain fast, eliminate some of that numbness and tingling there. And in the next few clips, you'll see here some of those rehab exercises, some of those soft tissue work, the shockwave therapy, what that treatment might look like for you when you come into our office. So feel free to reach out if you have any questions regarding this condition. We're happy to help. Feel free to check out our Instagram series on carpal tunnel syndrome versus median nerve entrapment. That might help you learn more about what you're experiencing in the condition. And feel free to reach out to us on social media, always there too as well. Take care. So here you can see Dr. Gage is demonstrating a median nerve glide here. This is something that can be extremely beneficial with median nerve entrapment or carpal tunnel-like syndrome. Here we're going to go into the next clip of shockwave therapy, working over those forearm muscles. Additionally, here working those forearm muscles more at where they originate from with some weight here. And then finally into the forearm extensor muscles where they originate up near the elbow here, also working with some weight to help free up tension in the forearm.